Welcome to our first webinar within a series of webinars we are launching, headlined The Politics of Social Justice in Lebanon Between Citizenship, Identities, and Compounding Crisis. The series is part of the Center's ongoing work on social justice, and particularly it's part also of a partnership with UNICEF on advancing a social welfare state and social justice in Lebanon. The series in general aims to unpack the many unfortunate challenges and shortages in the social justice system in Lebanon on several levels and also across several categories of people or actors, as we will see, in addition to exploring the required policy reforms and approaches which are of dire necessity. I will introduce myself very briefly. I am Stephanie Daher. I am a researcher at the Center for Social Sciences Research and Action, and I will be moderating today's session. I encourage you to participate actively in raising questions to the participants, to the speakers, in line with their expertise and professional experience. This introductory webinar first aims at critically exploring how the scattered and the contributory-based ad hoc social system in Lebanon provides social assistance along ethnic, class, identity, and political lines, giving way for exclusionary mechanisms, as we will see during the session. It will explore as well with our speakers how to shift from a charity-based approach to a citizen-based approach. After the presentations of our speakers, we will move on to a Q&A discussion, and I encourage you to raise questions in order to have a very fruitful and interactive discussion today. Before starting, allow me to draw your attention on our recent publications on the topic by the Center, where we have recently published a briefing report titled An Intersectional Perspective on Social Insecurity by our colleague, Dr. Michele Scala, and also a timeline of social protection in Lebanon, which retraces the main stages of the construction of social protection systems in the country. So let us start. I remind you also that interpretation is available. So in case the speaker is talking in Arabic and you need interpretation in English, it is available, and vice versa. So we will start with our first speaker, Mr. Ziad Abdelsamad. He is the executive director of the Arab NGO Network for Development, which is based in Beirut, where since 1999 and brings together 30 NGOs and 9 national networks from 10 Arab countries active in the protection of social and economic rights. Mr. Abdelsamad has extensive experience in economic and social public policies, where he was engaged in many global and regional networks, as well as research institutions. He is also a part-time instructor at the Lebanese American University. Thank you, Mr. Abdelsamad, for accepting our invitation. أهلا وسهلا فيك. The floor is yours. تفضل.
Well, thank you for the introduction. Allow me to speak in Arabic, لأنه the topic is a little bit, we need to focus more and to easily to use our language. الحقيقة خليني أقول إذا بدنا نحكي شوي عن نظام الحماية الاجتماعية بلبنان، أنا بدي أنطلق من فكرة إنه الحماية الاجتماعية هي وحدة من الأدوات الأساسية لتعزيز المواطنة، ووحدة من الأدوات الأساسية المعتمدة عادة لإعادة توزيع الثروات، إعادة التوازن إلى العلاقات الاجتماعية، وبالتالي استتباب العدالة بين مختلف الفئات الاجتماعية من خلال طبعا معروف إعادة توزيع أنظمة ضريبية، ولكن نظام الحماية الاجتماعية هو جزء أساسي من هذا الموضوع. وبالتالي هي توفير التأمين الاجتماعي والمساعدات الاجتماعية، و تشمل أيضاً بشكل أو بآخر سياسات اللي لها علاقة بسوق العمل وحماية العمالة. طبعاً لما نقول نحن إعادة توزيع، نحن بنحكي عن أنظمة تمول أو من خلال الضرائب، وبالتالي من خلال العائدات الضريبية أو الدولة والقطاع العام، أو من خلال الاشتراكات ومساهمة المستفيدين. خليني يعني المقاربة عندي تنطلق من هون. زيد عليها أنه بالنسبة إلي لما أحكي على موضوع المواطنة ومفهوم المواطنة، مرتكز بشكل أساسي على المفهوم الحقوقي. المواطنة هي مجموعة من الحقوق والواجبات التي تنظم العلاقة بين المواطن والدولة، وبالتالي السياسات الاجتماعية وهي بمفهومي أنا بما أنها مرتبطة بالمواطنة، فإذا هي مقاربتها يجب أن تكون مقاربة حقوقية. شو في عنا نحن الحقيقة بلبنان؟ حتى ما طول كتير خليني أقول، صار كتير معروف أنه نحن في عنا نظام حماية مجزأ متنوع وبيمنح خدمات متنوعة ومختلفة، ولكن معظمها مرتبط بسوق العمل. في عنا بشكل أساسي 54% من العاملين اللبنانيين بيستفيدوا من شيء اسمه الصندوق الوطني للضمان الاجتماعي أو الضمان الاجتماعي، اللي يمول عادة من مساهمات العمال وأصحاب العمل. طبعا الصندوق الوطني للضمان الاجتماعي عنده إدارة مستقلة، ولكن يخضع لوصاية الحكومة بشكل أساسي لوزارة العمل. إدارته مثلثة الأضلاع، يعني الإدارة بمجلس الإدارة في ممثلين للعمال، ممثلين لأصحاب العمل، وممثلين للحكومة. من حيث المبدأ في 4 فروع. في فرع يلي هو التأمين الصحي، واللي بيشمل الأمومة والطفولة. الفرع التأمين الصحي والدواء هو الفرع اللي أكثر واحد بيشتغل. فرع الأمومة والطفولة بيشتغل جزئيا. طبعا الفرع الثاني هو الطوارئ، طوارئ العمل، وهو لا يعمل، يعني من حيث المبدأ اللي له علاقة بالبطالة أو أي طارئ بيصير خلال العمل، وهذا بعده ما بيعمل. في الفرع اللي له علاقة بالتعويض العائلي والتعليم، واللي كمان جزئيا بيشتغل. والفرع الرابع اللي هو التعويض نهاية الخدمة، وهيدا يلي هو بيشتغل وعليه إشكالية. خليني أقول إنه قبل خليني أنتقل في هون فئة العمال في القطاع الخاص. فئة العمال في القطاع العام بيستفيدوا من نظامين: نظام تعاونية الموظفين اللي عمليا بيغطي 5% من العمال، 5% من الفئة العاملة. وبالتالي تعاونية الموظفين هي أكثر كرما في تغطيتها من الضمان الاجتماعي. والفرق بينه وبين الضمان الاجتماعي إنه هي بتعطي تعويض شو بيسموها تعويض طوارئ عمل، تعطي منح للزواج، وأيضا تعطي معاش تقاعدي بدل ما يكون تعويض نهاية خدمة. يعني بالقطاع الخاص الضمان الاجتماعي بس يخلص الواحد على سن التقاعد، يعني 64، بياخد تعويض نهاية خدمة حسب سنوات الخدمة، وتنقطع عنه الخدمات الصحية، وبالتالي يصبح مسن عنده تعويضه وما في عنده أي تغطية صحية تاني إلا إذا كان في عنده تغطية صحية بالقطاع الخاص. بينما بالقطاع العام بضل يتقاضى معاش تقاعدي وبضل يستفيد من خدمات. فإذا هيدا 5%. وفي الفئة الثالثة أو الفئة الثانية من القطاع العام اللي هن القوات المسلحة والجيش، اللي عمليا بتغطي 16% من العاملين أو من بسن العمل. وهون كمان في كومبينيشن بين تعويض نهاية الخدمة والمعاش التقاعدي، وأيضا في يعني خدمات إضافية تعطى. خليني اقول انه بمجمل واخر احصاء طلع عن دائره الاحصاء المركزي بيقول انه عموم السكان المشمولين بالتغطيه، وحده من هالثلاث فئات، هن 56% من السكان، ومن هال 56% 10% بس بيحصلوا على تعويضات تقاعديه، والباقيين بياخذوا بس مثل تعويض نهايه الخدمه. بدي اضيف انه في 5% من العاملين، يعني هيدي فئه رابعه اذا بدنا، بيستفيدوا من صناديق تعاضديه، خاصه يلي بيشتغلوا بالمهن الحره، يعني نقابات المهندسين والاطباء، مهندسي الاسنان والمحامين والقضاة، في عندهم صناديق تعاضديه، هول بيشكلوا 5% من السكان. هيدا بشكل عام إذا بدي الأنظمة الحماية الاجتماعية اللي موجودة أو أنظمة الرعاية الاجتماعية اللي متوفرة في لبنان. بينضاف عليهم طبعا في شبكات الأمان الاجتماعي يلي بتوفرها وزارة الصحة، يلي عمليا بتساهم بنسبة 85% تغطية من كلفة الاستشفاء للمواطنين، ولكن اللي بده يستفيد من هذه التغطية لازم يأكد أو يبرهن أنه هو بحاجة إلى هذه المساعدة، يعني فقر حال أو بطالة أو وضع اجتماعي قاهر. وأيضا وزارة الصحة من خلال شبكة الأمان أو نظامها بتوفر أدوية الأمراض المزمنة بشكل عام، وخاصة العلاج للأمراض المستعصية مثل السرطان وغسيل الكلى وغيره. في برامج للحماية الاجتماعية عند وزارة الشؤون الاجتماعية، وخاصة الأكثر شهرة هو برنامج الأسر الأكثر فقرا يلي بموله البنك الدولي. كل البرامج، يعني برنامج وزارة الصحة بتموله وزارة الصحة من الموازنة العامة، يعني من ضرائب المواطنين ومن الجباية، بينما وزارة الشؤون الاجتماعية برامج الأسر الأكثر فقرا بموله البنك الدولي. هلا في شيء غير ملحوظ اذا الواحد بيطلع شوي على السيستم، عم بحكي على النظام الصحي بشكل عام بلبنان، في نظام حمايه اجتماعيه غير نظامي، يعني انفورمال، وهيدا يؤخذ بعين الاعتبار، لانه قبل الازمه كان فاعل جدا، ولما اجت الازمه في عندي شرائح كثير من المواطنين اللي ما كانوا بحاجه او ما كانوا شايفين حاجه الى انهم يكونوا عم يستفيدوا من اي نظام للحماية الاجتماعية أو رعاية اجتماعية. هلأ مع الأزمة واشتدادها هول اللي بدهم يصيروا أكثر حاجة. عم نحكي نحن على 8% من اللبنانيين مثلا في عندي أو بعض الأطر المجتمعية الكوميونيتي انستتيوشنال أو العائلية، في شبكة المنظمات غير الحكومية، وفي شيء الأحزاب السياسية والمنظمات الطائفية أو والمذهبية. وهون خليني أقول بتلعب دور كتير كبير في هذا المجال، وهاي بدي أقول إنه دورة مهم، ولكن إلى هي أداة سياسية أساسية في إعادة تدوير إذا بدي النظام الخدمات الزبائني من خلال توفير خدمات للمواطنين. بس هيدا اللي بدي أقول أنا، إنه بهيدي الروابط الأسرية تقريبا في تقدير إنه 74% من المسنين مثلا يلي عايشين على الإعالة، يلي ما عندهم مداخيل وما في عندهم تغطية صحية ولا تغطية اجتماعية، 74 منهم عايشين على المعونة العائلية، وخاصة من تحويلات المهاجرين، يعني الريميتنسز يلي بيستفيدوا منه. وهاي فئة مهم كتير نحن هلأ نلحظها، لأنه هيدي الفئة يلي هلا بظل الأزمة الاجتماعية وعدم قدرة هذه الأواصر العائلية إنه تساهم بالتغطية بدها تعاني من الأزمة. فإذا بشكل عام خليني أقول إنه نظام الحماية الاجتماعية يفتقد إلى مسألة كتير. أول شيء يفتقد إلى العدالة، لأنه هناك تفاوت في توفير الخدمات بين الفئات. وهلأ بدي أرجع أحكي إنه في تمييز بين الجنسين بشكل أساسي بحق المرأة. 77% من النساء مثلا لا يتلقين منح تعليمية للأولاد اللي لازم يوفرها الضمان الاجتماعي أو التعاونية. 58% منهم ما بيتلقوا مثلا بأزمة الكورونا. النساء اللي مرضوا 58% منهم ما أخذوا تعويضات، يعني توقف أجرهم لما كانوا مرض. 79% من المؤسسات توقفت عن دفع المعاشات لما صار في إغلاق مثلا نتيجة كورونا. 51% من المؤسسات صرفت العمال، معظمهم من النساء. فإذا في تمييز كتير في إطار هذا النظام طبعا، وفي تمييز بحق اللبنانيين وغير اللبنانيين، لأنه نحن ما حكينا أنه بحدود 20% من المقيمين في لبنان هم غير لبنانيين، بين سوريين وفلسطينيين وجنسيات أخرى. هؤلاء لا يتمتعون بأي تغطية اجتماعية إلا بالمنظمات الدولية أونروا أو UNHCR. وأيضا بإطار عدم المساواة والتمييز، هناك تمييز بين العاملين في النظام النظامي يعني الفورمال واللي عاملين في القطاع غير النظامي. في تمييز بين اللي بيشتغلوا بالقطاع الخاص واللي بيشتغلوا بالقطاع العام واللي بيشتغلوا مع القوات المسلحة. في تمييز بالمهن الحرة عن سائر، لأنه المهن الحرة أكثر كرما من غيرهم. وطبعا في تمييز بالوصول إلى الخدمات، خاصة إذا حكينا على مستوى المناطق. الشغلة الأولى هيدي، فإذا التمييز. الشغلة الثانية إنه هيدا النظام الحماية الاجتماعية ما بيوفر تغطية على كافة مراحل الحياة. يعني احنا بنحكي على كافة مراحل الحياة، يعني الطفولة، يعني سن العمل، ويعني المسنين. نحن إذا ربطناه فقط بسن العمل، وبالتالي نحن حرمنا الطفولة من أنه تكون مستفيدة، وحرمنا المسنين من أنهم يكونوا مستفيدين. وهذا يتطلب أنه نعمل يعني تعديل على المنظومة. خليني اليوم بدي أقول، يعني نحن حكيت أنا هلأ عن شو موجود بلبنان، بس هلأ نحن لازم ناخد بعين الاعتبار الأزمة اللي صارت، الأزمة الاقتصادية والاجتماعية والأزمة المالية، تداعيات الانفجار اللي صار، وكورونا. 3 أزمات متتالية. وهلأ يلي بعد ما لحقنا نرصد تداعياته بشكل كتير خطير هو اللي شي عم بيصير بأوروبا، والحرب بين أوكرانيا وروسيا، واللي له تأثير كتير كبير على الاقتصاد العالمي، على النظام الغذائي العالمي، وعلى توفير المحروقات والطاقة في العالم. خليني بس أقول انه الفقر بلبنان اخر مؤشر صدر عن دائرة الاحصاء المركزي بيقول 22% من اللي بيتقاضوا اجر من العاملين اجر دون 633 ألف ليرة، يعني دون الحد الادنى للاجور. و42% من الاسر يقل دخلها عن 1,200,000 ليرة، و73% عن 2,400,000 ليرة. من شان هيك هن بيقدروا انه 73% من الاسر اللبنانية هم بحالة فقر دخل بشكل اساسي. فقط 6% من اللبنانيين دخلهم اكثر من 5 مليون. هيدي احصاءات على دولار 1005 قبل ما يتدهور سعر العملة. هلا نحن لازم ينعاد النظر بكل هيدا شو اسمه. فاذا اول شيء موضوع الفقر في لبنان يلي لازم يعني ينعمل. الموضوع الثاني الامن الغذائي، والكل بيعرف انه الارتفاع الساحق في الاسعار المواد الغذائيه. وهلا برجع لحتى اقول انا بتكوين مصروف الاسره ليش انا عم ركز على هاي القضايا. موضوع الصحه والخدمات الصحيه، واللي تبين من خلال ازمه كورونا انه النظام الصحي بلبنان نظام تداعى، نظام التعليم في لبنان تداعى، وكل نظام الخدمات الرعائيه اللي بتطال المعاقين، المسنين، الرعاية النفسية، العنف الأسري، كل هيدي القضايا. السكن والإنفاق الأسري على السكن. وطبعا عم نحكي على سوق العمل. 220 ألف فرصة عمل خسروا اللبنانيين خلال العام 2020، يعني هيدي الإحصاءات بعدها ل 2020. بدي بس أقول شغلة إنه انفاق الأسر بشكل أول أكبر انفاق للأسر عم بيكون على السكن، واللي بيتضمن الكهرباء والمحروقات والمي والغاز، والكل بيعرف انه هول كلهم سوا اسعارهم ارتفعت جدا. الفئة الثانية او القسم الثاني، الشطر الثاني الاكثر انفاقا في الاسر هو المواد الغذائية، واللي مش بس عم ترتفع، ولكن عم نبلش نشوف نقص حاد بالمواد الغذائية، خاصة بالزيوت والقمح وغيره. هلا موضوع النقل صار عم بيشكل حالة خطيرة، وبالتالي يعني نحن عم نحكي على البنزين والنقل اللي عم بيصير كتير مكلف. الخدمات الصحية واللي في إشكال مع الجهات الضامنة وشركات التأمين، اللي ما بقى يعني في مشاكل بينه وبين المستشفيات على موضوع الاستشفاء في الدواء اللي صار مفقود بمعظمه لأنه الاستيراد صار متعثر، وبالتالي الخدمات الصحية بشكل عام. التعليم يلي صار مرتبط بالاتصالات، يعني خامس باب للإنفاق هو التعليم، سادس باب للإنفاق هو الاتصالات، وبالتالي صاروا مرتبطين ببعضهم، خاصة بموضوع التعليم عن بعد. وهون من شيء أنا عم أقول هذا الكلام لحتى أقول إنه أي نظام حماية اجتماعية بلبنان عندما يصمم لازم ياخذ بعين الاعتبار كل هاي القضايا. ما بقى فينا نقول إنه نظام الحماية الاجتماعية مش معني بمواصفات وشروط السكن، مش معني بالأمن الغذائي، مش معني بموضوع النقل والانتقال واللي صار بشكل أعباء أساسية على المواطنين، ومش بس معني بالصحة وبالتالي وبالتعليم وبهاي القضايا. بس خليني يعني أختم لأقول إنه هناك أي مقاربة لوضع نظام للحماية الاجتماعية بلبنان يفترض أول شيء أن تأخذ بعين الاعتبار الترابط بين الأزمة الاجتماعية يلي نحن عم نشوفها هلأ، أشرت للفقر وأشرت للقضايا الثانية، والمعالجة المرتبطة بالاقتصاد الكلي. يعني ما بقى في مجال نحن نحكي بدون ما يعني، والأزمة المالية والإصلاح المؤسسي والحوكمة. خليني أقول أول شيء توحيد سعر الصرف. ما ممكن يكون في عندي أنا تفاوت بسعر الصرف، بشتري مواد غذائية على سعر صرف، بشتري دواء على سعر صرف، بروح على المستشفى بسعر صرف، وبالتالي في هيدي إشكالية. إعادة هيكلة المصارف، لأنه كلنا سوا صرنا بكاش ايكونومي، ما بقى في عنا نظام مصرفي عم بيساعد وعم يشتغل، وما في اقتصاد بدون ما يكون في نظام مصرفي. وتعزيز الشفافية والمؤسسات. هيدي فإذا أول نقطة بيلر أساسية في أي نظام لازم يبلش من هون. هذا الترابط هو ترابط ضروري. الشغلة الثانية لازم يكون في ترابط بين التدخلات الآنية، يعني البرامج اللي عم تنعمل اليوم بين الأسر الأكثر فقرا، أو البطاقة التمويلية اللي لازم تغطي 60 أو 70% من الأسر وإلى آخره. هيدي التدخلات الفورية اللي أساسا عم تجي نتيجة ديون لازم تكون مرتبطة برؤية بعيدة المدى، وبالتالي وفق نظام أو تصور لنظام أو هيكل نظام للحماية الاجتماعية الشامل. وبالتالي هي بدها تكون بالتدرج بتدخلات آنية ومرحلية وصولا إلى نظام الحماية الاجتماعية. لازم يكون طبعا شامل، وبالتالي بالكوست افكتفنس، يعني بالفيزيبيليتي، بيتبين انه هاي التدخلات الآنية وهيدا النظام المجتزأ في حال توحيده شموليته بيصير كلفته اقل، بدل ما يكون في عندي انا استهداف مباشر للاكثر فقرا او لبعض الفئات الاجتماعيه. طبعا المقاربه الحقوقيه، وهيدي بالنسبه لي انا مركزيه لما بنحكي نحن على المواطنه والحمايه الاجتماعيه. المقاربه الحقوقيه هي الاساس، وبنحكي عن المقاربه الحقوقيه يعني مساواه، يعني شمول، يعني كل هيدي القضايا. وليش الشمولية؟ لأنه لبنان يتميز بأنه أكثر دولة من أكثر دول العالم تفاوتا في توزيع الثروات. أغنى 10% من اللبنانيين عندهم 70% من الموارد من الثروة. 70% يعني بيملكوا 232 مليار، وهيدا دائرة الإحصاء المركزي بتحكي عنه. 85% من الودائع هي ل 8% من السكان، و60% من الودائع 60% من أصحاب الودائع بشكله بس نص بالمية من قيمة الودائع، وبالتالي فينا نشوف قديش في تفاوت بتوزيع الثروات، وبالتالي نظام الحماية الاجتماعية بدون ما يكون في مقاربة للاقتصاد الكلي تحقق العدالة بيكون نظام غير كيفي. خليني اكتفي بهيدا إذا بدك فيني أقول أنا يعني بدي أختم عفوا فيها هيدي، إنه شفت أنا القطاعات، إنفاق الأسر على القطاعات، يعني 30% من إنفاق الأسرة بيجي على قطاع الصحة، 25% 25% على التعليم، 13% على السكن والأوضاع المعيشية، علما أنه في اكتظاظ سكاني، و6% على البنية التحتية. هيدا الإحصاء يلي كان قبل الأزمة، هيدا يلي تركب عليه النظام الحماية الاجتماعية بلبنان. وبالتالي نحن هلأ البنية التحتية، يعني الكهرباء صارت تفوق الاشتراك الشهري بالكهرباء، الانفاق الشهري للأسرة صار يفوق الحد الأدنى للأجور. الإيجارات بالسكان، ونحن جايين على 2026 2024 بيخلص مفعول قانون الإيجارات، وبالتالي في عندي أزمة اجتماعية جاية نتيجة السكن، وطبعا هلأ موجودة. نحن بنحكي على موضوع التعليم والإنفاق على التعليم وخاصة الاتصالات، بنحكي على النقل قديش صار مكلف بالنسبة للأسر، وبالتالي كل النظام الصحي. فلذلك نحن بحاجة إلى إعادة نظر شاملة من الأساس في كل النظام الصحي القائم، يلي لازم يقوم على المقاربة الحقوقية، على نظام شامل بياخد بعين الاعتبار التدرج بين التدخل الآني واللونج تيرم فيجن، يعني الرؤية بعيدة المدى. شكرا.
شكرا لك أستاذ عبد الصمد، يعني أعطيتنا رؤية كاملة وعن كل البيلرز اللي مهم نحكي فيها وقت نحكي عن النظام العدالة الاجتماعية والحماية الاجتماعية بلبنان. أنا بس استوقفني، حابة يعني إذا في مجال بس أسألك. حكيت عن 8% من اللبنانيين وقتها حضرتك حكيت عن الانفورمال provision of services، اللي هي بالعربي النظام الزبائني أو المعروف بالكلاينتلزم. بس حابة استوضح منك إذا في مجال 8% زيادة هيدا الرقم عن البرسنتج اللي عادة كانوا يلجأوا للخدمات الزبائنية، يعني بس حابة أعرف ال 8% عشو it refers to specifically. الميكروفون is off.
أنا كنت عم أقول إنه في 53% ضمان اجتماعي، وكنت عم بحكي 5% تعاونات موظفين، و16% قوات مسلحة، و8% بيستخدموا من النظام الخدمي النظام المعونة الاجتماعية. هيدي الإحصاءات يلي كانت قبل الأزمة. بدي أقول إنه هلأ نحن ما في عنا معطيات بعد، لأنه ما صار في إحصاءات نهائية لحتى نقول كيف صار الترتيب الجديد. بس فيني أقول أنا إنه الخدمات 50 أو 52% اللي كان يوفرها الضمان الاجتماعي تدنت إلى الحد الأدنى، لأنه الضمان الاجتماعي مفلس، مصرياته في المصرف المركزي محجوزة، وهلأ اشتراكات مش عم تندفع، وبالتالي كل الخدمات، وفي عنده مشاكل أصلا مع معظم المستشفيات. يعني الأسبوع الماضي تحديدا المستشفيات قررت أن تتوقف عن استقبال مرضى الضمان الاجتماعي. فإذا نحن عم نقول إنه هيدي 8% مرشحة إنه تزيد كتير مع احتدام الأزمة، ومع يعني توقف الأنظمة الرعائية عن توفير الخدمات، وزارة الصحة، الضمان الاجتماعي وخلافه. فإذا زادت جدا، واستفادت منها الأحزاب السياسية خاصة، والآليات النظام الزبائني استفادت منها كتير، خاصة بظل الجائحة. وشفنا نحن كيف صار في مساعدات مباشرة للمواطنين، بين غذائية وبين صحية وبين مساعدات عينية وإلى ما هنالك. وهيدي الخدمات الزبائنية هي هلا يلي عم يستفيدوا منها بالانتخابات اللي جايه قريبا لإعادة تدوير الصورة، وما حدا في عنده والمفارقة انه النظام الانتخابي بيعطيهم كل خدمة عمرها أكثر من 3 سنين بيعتبرها منا إنفاق انتخابي، وبالتالي صار النظام الزبائني مشرعا في القوانين. فإذا إيه نعم 8% أنا برأيي صارت أكثر بكثير من هيك، بس ما بيقدر الواحد هلا يقدر لأنه بعد ما صار في دراسات معمقة حول الموضوع.
شكرا لك أستاذ عبدالسمد. الأسئلة يلي انكتبت بالشات ما رح هلا ما رح أطرحها هلا على السبيكرز، لأنه we have to move on for our second speaker يلي دكتور عبد الهادي العجلة، لأنه ما رح يقدر يكون معنا لآخر السيشن given professional commitment. So I will briefly introduce him. So I briefly introduce him and leave the floor to him. Dr. Al-Jila is a social and political science and the author of Trust in Divided Societies by Bloomsbury Academics and IB Tauris UK. He is an associate researcher and the regional manager of Varieties of Democracy Institute at Gothenburg University for Gulf countries. He holds a PhD in political studies from the University of Milan and an MA in public policy and governance from Zeppelin University in Germany. Please, Dr. Al-Jila, the floor is yours. Go ahead.
Thank you, Stephanie. شكرا Stephanie. أنا راح أحكي يعني زياد صعبها شوي علينا. بلش في العربي فصعبتها شوي على زياد. بفضل دائما باللغة اللي بكتب فيها أقرأ فيها كبروفيشنال لانجويج. شكرا كثير، وزياد حكى بشكل كثير ديتيل عن السوشيال بروتكشن سيستم في لبنان، وركز على كثير قطاعات مهمة يعني كبروفيشنالز اكسبرتس وساينتست احيانا بنغفل عنها. وراح ابدا بالانجليزي. عنوان هذا الانترفنشن هو مبني على ورقه راح شغال عليها او بروجكت on social protection system in the Middle East. ولبنان هون اسم الورقه out of the frying pan into the fire. وهذا من تحت الدلف لتحت المزراب او هيك باللغه العربيه. وهذا كنايه عن كيف انه كان في ازمه اقتصاديه في لبنان، ودخلت ازمه كورونا بعد هيك، واجت اللي هو البوليتيكال ديدلوك في لبنان، اللي هو دائما مثل ما حكى زياد مرتبط الاراده السياسيه مرتبطه دائما بالبوليسي تولز، والبوليسي تولز السوشيال بروتكشن سيستمز وبرامجها هي أداة مهمة من أدوات الإرادة السياسية. The pandemic highlights a very serious gap with the social protection system, not only in Lebanon, but also in the whole Middle East. But in Lebanon, because the high level of inequalities that Ziad mentioned that, and also the political deadlock, this inequality was more visible, especially with the pandemic and also the economic crisis. I think the economic crisis and the COVID-19 crisis also increased the distrust, the level of distrust and the collapse of the labor market, especially for the middle class or lower middle class in Lebanon, as which are the biggest spectra of the whole society. And this inequalities, as Ziad said, the housing amid inflation, the access to health system, clean water, sanitation, but also some very important goods that's related to the, for example, hygiene, for example, clothes, and now with the war, the food scarcity. We need also to focus on the informal workers. I know that it's usually in Lebanon that big number of the people in Lebanon are informal workers, so they didn't have access to الضمان الاجتماعي for the social protection system. The women and youth are the most affected, and because of the confluence of inequalities, but also the most of those, like especially women and youth, they don't have savings, and that's why they had to go back between 2020 until now. They had to go back to their villages because we have the informal social protection system, which is the solidarity mechanism among the people themselves. So according to the ILO, the social protection system, it's the indispensable institution that's not only to deliver support for disadvantaged people, but also to protect them from falling into poverty. And it is an essential mechanism for keeping the community viable and can minimize inequalities in society. But it has 3 or 4 major elements. One is to remove the barriers to high quality healthcare provision. In Lebanon was one of the countries that provide high quality health care provision somehow, but most recently in the last 2 years, we are seeing a collapse, especially when it comes to the immigration of highly professional doctors, but also the inability of the government to pay back the private hospitals, because almost 80% of the hospitals in Lebanon are private. Second is protecting income, and this is an element. Third, protecting jobs and preventing disadvantaged groups from falling into poverty, or I would call it falling again into poverty, because some of them in the last 10 years, they made good steps. Lastly, effective and wide coverage of this. It's like Ziad said, that's in الضمان الاجتماعي and SSF, they cover some 50 or something, 54% of people who work in Lebanon. But of course, it's not the working class in the public sector, but the majority of people in Lebanon are not covered by this. So here I will focus on 3 areas. One, the missing opportunities and the refugees. And second is the inequality and accessibilities in Lebanon. And the third one is on the people's needs that haven't been met in Lebanon. The first one, I would pass it very quickly about the labor minister last year, when he issued a decree that giving the Palestinians the right to work in most of the areas. That was a good opportunity, actually, to provide somehow social rights for the Palestinian refugees, who are around 200,000 Palestinians. The numbers was 500,000, but with the Lebanese government, for instance, a few years ago in 2018, they were just around 200,000 Palestinians, and they have 300,000 or more Palestinians in diaspora who are sending money to those 200,000 Palestinians who living in Lebanon. And this missing opportunity, I'm saying missing opportunity because in February 2022, last month, the State Shura Council issued the ruling number 93 to halt the implementation of the Labor Minister of November 2021 to grant the Palestinians who born in Lebanon permits to practice the wide range of professions that was restricted to only Lebanese. Giving this and saying that around, I think, this huge number of the Palestinian there, and giving the fact that the UNRWA also is engaged, and many international organizations are engaged in providing healthcare, providing social protection system and services for the Palestinians. There was ability to include the Palestinian in the Lebanese social protection system, conditioning that to being a taxpayers. There is one aspect that if the Palestinians were able to pay taxation like anyone who travel abroad and work as an immigrant or an expat and could pay taxation. This would be a new source of income for the Lebanese social protection system, but also there's also opportunity to collaborate with the Palestinian Authority, or let's say the PLO, that could provide somehow some financial. I know for the fact that thousands of Lebanese and Palestinians still receive some cash from the PLO annually. I know for the fact that there are 3,000 Lebanese families, Lebanese, not Palestinians. They receive the $300 every month from the Palestinian Martyrs and Injured Department. So this kind of thing that could be institutionalized in Lebanon. I'm talking about civil rights because somehow it's a side not related to the political rights. So I know the sensitivities in Lebanon always on the spot. Sometimes that the Palestinians, the Tawtin, which is nobody is talking about that. I'm talking about the civil rights. And so this is the first point that I would say that refugees issues could be an opportunity, especially the Palestinians, not the Syrian refugees. Syrian refugees, they have the opportunity to collaborate with the international NGOs, with the UN agencies to provide somehow health care to them based on social protection, Lebanese social protection system criteria that they should pay monthly or annual fees for every refugees as part of this social protection system, instead of paying this for the service. This somehow could increase the coverage, could be somehow also a new income for the Lebanese social protection system. It's a strategy that needs the will, the political will, but also some bureaucratic and needs. The second point here I want to move on is the inequality and accessibilities in Lebanon. For some reasons, many initiatives focus on provision of in-cash, food, vouchers, healthcare, but of course, to mitigate the response to the causes, that we need to look back and to zoom in and out. I want to share here somehow, what is this one? Okay, here, if we look at this map, this graph, we could see that Lebanon has for a long time, since 1982, there is access to the public service distribution by urban rural locations, to the access to state business opportunities by urban rural location as well, exclusion and state jobs by urban locations. We see they are very low. And here, what I wanted to say is that there is a clear there is here a clear division and marginalization of the rural areas in Lebanon. According to the varieties of democracy institutes, the access to public service, state business opportunities, jobs, and exclusion of rural areas for the last 3 decades increased inequalities. And that's why we see somehow the social protection systems mostly focus on some urban areas, rural areas. They receive some ad hoc programs. They receive little to, and we see the gap there. The Lebanese society, and if we consider that, has been suffering from the lack of institutional and generalized trust. Actually, it's the second most untrusted society after Turkey in the world, the Lebanese society. Now, more than 90% of the Lebanese don't trust each other. and that was based on 2018, and I think now it is increasing. Also, giving the 2019, and then the unsatisfaction of the performance of the government, inequality, corruption, the lack of safety and security, and sectarianized judicial and political system. The trust hole is increasing, and it reflects the inability of the government to meet the society needs and demands. The COVID-19 crisis here, for example, if we look at the Arab Barometer data from 2020 and 2022, the COVID-19, it wasn't a priority for the Lebanese. Mostly, it was the economic suffering, the economic situation. The fear from not being able, for example, to secure food. Many of the Lebanese, 20% of the Lebanese in 2021 were afraid that next week they wouldn't have enough food to feed their families. In April 2021, and after the dramatic rise of death due to the coronavirus, 61% of the Lebanese still perceive the virus as the main challenge in Lebanon, while only 7% perceive the spread of the virus as the main challenge. By the end of 2020, which is 1 year before, I think, only 5% of the Lebanese perceive the spread of the virus as the main challenge, while 74% perceive the deteriorating economy as the biggest challenge. This reflects how the Lebanese are thinking, because it's a contextual and the economic, the fear from falling into poverty, the inability of the government to meet the people's demands. In terms of satisfaction with the government's performance and services provision, it has been always low. And it always, after every year, the Lebanese government shows that they are unable to do anything. It decreased dramatically with the current financial and economic crisis, Beirut explosion, and then the COVID-19 mishandling. In April 2021, 68% in Lebanon said that they were utterly dissatisfied, while 28% said they were dissatisfied, which means almost the great majority of the Lebanese were not satisfied with the performance of the government. Only 3% said they were satisfied. These 3% satisfied with the government performance are either employed or self-employed. But of course, this reflects how the distribution of income and who are the ones who are usually satisfied. They are usually benefited from the status quo. When it comes to the health sector, the Lebanese system or the Lebanese in general, they are very unsatisfied with that. In April 2021, 43% said they were totally dissatisfied with the healthcare system, and 40% were dissatisfied. So 40 plus 43, it's 83. But after the Beirut explosion and the exponential increase of COVID-19 in August 2020, that was 1 year before this, 50% said they were utterly dissatisfied with the healthcare system performance, while 37% showed dissatisfaction. So it's always dissatisfaction in the last 2 years, because if we look at the same numbers in 2017 and 2018, 27% were utterly dissatisfied, while a huge number, like 25%, were satisfied In 2015 and 2016, 36% were satisfied, and 25% were only dissatisfied. So it was along the years, we can see that the dissatisfaction with the healthcare system increasing. That change of perception during the last decade is linked to the poor performance of the government, lack of resources, and corruption. And here it has to do also with the ability of the government to build a public or a trusty social protection system with the focus on healthcare provision for everyone. And in that capacity, I wanted to borrow Melanie comment when she said that usually in Lebanon, especially political parties, usually weaponized social protection system, and because they wanted to provide their own services in order to buy loyalties of the people, and the public and comprehensive independent social protection system will, of course, neutralize weaponization of these services against the people, and will affect the ability of political parties to mobilize people. My last point here is about the people needs that haven't been met in the last 2 years. The Lebanese government hasn't developed a comprehensive social protection system. And indeed, for the last 10 years, they have been talking about the strategy to build a social protection system. The 3 programs that they are being developed, I'm surprised until now, and the al-Bitaqa al-Tamwiniya, it is still under debate. And the digital system is not working. And it has spent 1 year debating while people are falling into poverty. But the NPTP program, which has been working since 2006, it is still functioning, but it has, as Ziad said, the 3 tribal rectangles, the Council of the Ministers, Minister of Social Affairs, and then you have the Daman and other organization. So it's still complicated. There is no comprehensive social protection system in Lebanon, and most of the ad hoc programs that's and it is based on international aid from the Italians. For example, the Italians are the one who paid the $250 million for the al-Bitaqa al-Tamwiniya, which was approved by the World Bank, for example. The Lebanese Ministry of Social Affairs, the Council of Ministers, have been claiming to develop a social protection system where foreign donors and international agencies provide full support, waiting for actions from the Lebanese government. The result is the absence of a social protection system amid the crisis that harmed the Lebanese poorest and most vulnerable groups. By April 2021, around 85% of the Lebanese hadn't received any relief aid from the government during the pandemic, while 7% said they received money and 6% received food. In the same survey, 12% of the population said they lost their job, 12, and 26% said that their job was interrupted. According to the same sample, 18%, around 19% of who lost their jobs permanently haven't received anything from the government aid, while more than 41% of the people whose job was interrupted haven't received anything. The inability of the government to access the most vulnerable group is due to the lack of modern social protection system with the governmental oversight and support, but also more than half of the surveyed population in Lebanon, 51%, said that they get worried sometimes that their food would run out before they get money to buy more.
Sorry to interrupt you, Hadi, but we need to stick to the time. If you can please wrap up. I'm sorry.
Finishing, actually. Yeah. The social protection system in Lebanon is fragmented and ineffective, reflecting the political system in Lebanon that relies on nepotism, groupism, and partisan service provision. For example, almost every political party in Lebanon has exploited and weaponized the COVID-19 crisis, trying to provide services, equipment, and mobilize their members in the society. Thank you very much.
Thank you very much, Hadi, for your very detailed intervention and all the explanations which you have put forward. Indeed, it's a very complex shortage of system, whether we are talking about the social protection and the social security schemes which exist in Lebanon. I thought it was particularly interesting when you refer to the cosmetic, let's say, the cosmetic resolution which was put forward by the minister regarding the right to work, granting the right to work to Palestinians living in Lebanon. And as we have seen, it was eliminated and cancelled very simply by the Shura Council. And this is the type of resolutions which could be very simply modified or, as I said, eliminated by another minister. That's why we call them cosmetic, in the sense that they are not structural or they are not based on a long-term planning and real structuring of the granting the social protection and social security, not only to Lebanese, but obviously also to residents in Lebanon. So whether we are talking about Palestinian refugees, Syrian, and so forth. And also I would like to add here that given that the social protection and security scheme in Lebanon, they're strictly, let's say, being tightly related to the labor market. So if you are employed, then you have access to some very few, let's say, protection and social security, but also across professional categories. So, for instance, agricultural workers and construction workers in Lebanon are also excluded from such protection. So, I just wanted to add this thing. Thank you, Abdel Hadi. I know that you have to leave to the airport in a few, so I really appreciate your intervention today. I will now move to our last but not least speaker, Ms. Alexandra Barentis. Ms. Barentis is an international development expert with more than 21 years of experience in social protection, poverty, education, inequality, and economic, social, and cultural rights. She is currently a senior social policy specialist and head of social policy unit at Development Pathways. Ms. Barentis has global experience in high-level policy advice in the social protection and poverty field. She was part of several international working groups on poverty and social protection with key international stakeholders, to name a few: UNICEF, ILO, and UNRIST. Please, Ms. Barentis, go ahead. You have the floor. Thank you.
Thank you very much. Thank you very much. Good morning to everybody. It's a pleasure to be here, and thank you very much for the invitation. So I think I've got my way paved very easily because I've had extremely good interventions before me. So I'm very appreciative of that, providing the national context for Lebanon. I have included some aspects of particularly attaining to Lebanon, but I've also been asked to provide some insights into sort of a human rights-based approach and citizenship approach to social protection, and bringing some of those ideas into the conversation today. So I think many of the ideas that I'm going to be sharing today have already been shared by the previous speakers, but just to make sure that we have this conversation also based on some of these policy discussions at the international level, at the policy level within social protection, the social protection arena. it is important to remind ourselves that the value of shifting the paradigm, of shifting the way that we frame social protection is also of absolute key importance when we're having these conversations, right? And the idea is that a human rights-based approach to social protection provides that framework of, instead of framing social protection or social security, however we want to call it, into these charity handouts. And many of you have already been discussing or pinpointing to those sort of ad hoc, you've mentioned the ad hoc or the fragmented systems or programs that are being provided versus an entitlement, a citizenship approach. I'm shifting to using entitlement versus citizenship approach, because citizenship approach sometimes might exclude, for example, refugees and migrants and such. And so that's why I'm shifting a little bit towards using an entitlement approach, because what it means is that regardless if you're a citizen or not, there should be the right to social security, the right to social protection, right? So that's one distinction that I just wanted to make. So again, the framing social protection within this human rights and this entitlement approach allows us to look at social protection from a different perspective. It's not a handout. It's not a unequal relationship between a state that is providing gifts or that is providing charity or is providing poor relief, but it's a relationship, as my previous speakers were also discussing, right? And again, this graph shows a little bit the distinction between the two paradigms that you could create. And this is a very much of a summary in terms of a nutshell, in terms of how you could describe social protection from these two large paradigms, right? The citizenship / entitlement approach versus the charity paradigm. And again, within the entitlement one, you've got the right to social security. It's social security for all. It's not just for a few or for the others or for the poor, quote unquote. It has obviously a much larger investment by governments and international donors in terms of those schemes. They are inclusive schemes. They're not poverty targeted schemes, as we see. And also the quality of those programs, the quality of some of these programs was also mentioned before me. So that is absolutely key, right? And when we're talking about this versus a charity approach or a handout approach, where we have mostly poor relief poverty schemes, such as the ones that we saw in Europe before Second World War, and even before that in many centuries, like the old poor laws in England and in many European cities and countries in the 1500s, you see this view of them being handed over to people in terms of charity, obviously lower spending and investment in the social protection sector, and then mostly sort of leaving out many people, because unfortunately, we've done global studies. I don't have time to delve into that, but we can share with you some of those resources. But poverty targeting, like program sort of PMTs, for example, community-based targeting, and many other poverty targeting schemes that are used in poverty targeted programs actually leave most of those intended beneficiaries out. We've done a global study in which the least worst poverty targeting scheme leaves 44% out that they should be leaving it, and that should be including, right? I don't have time to go into that, but I can share, once I'm done speaking, I can share the link to that global evidence. So that's one of the ideas. Without going into further detail in terms of where does the right to social security or the right to social protection come from? It comes from a wealth of normative frameworks at the international level that I'm not going to describe in detail. We don't have that time, but it specifically establishes the right to social security, the right to social protection. And there's on the screen, you have various conventions and then also legally binding treaties and conventions signed by most countries, by which the right to social security is embedded as a right. And then you've got ILO recommendations such as 102 and 202 that provide even further details in terms of what a comprehensive, we've been talking about fragmented systems in Lebanon, we've been talking about what a non-comprehensive social protection system is, but some of these conventions provide the details in terms of what a comprehensive, inclusive and human rights-based approach to social protection would look like. And it provides very much detailed in terms of what it is and what it isn't. And I think one aspect that I wanted to highlight from this slide as well is something that has been discussed, because both the speakers before me have been talking about this sort of the social contract, lack of trust in government in some aspects here and there. And I think one of the key aspects of social protection, if we think of it as a human right, and as if we look at it from a rights-based approach, is this transformative power that social protection can have. It's not a silver bullet, it's not going to solve a country's problems, but it can be one of the key policies put forward for a transformative shift, so that we can have this solidarity pillar and sort of the intergenerational or the interclass, the inter-income levels, sort of sharing of resources and redistribution. And then I think that's something that, given this particular context, that we should sort of highlight. This graph shows here the relationship that many of you have been, the previous speakers have also been talking about, which is this relationship. And a human rights-based approach changes that relationship. Instead of having that handout in which you've got people that are using social services or being sort of uptaking social services, social protection services, being seen as passive agents, from a rights-based approach, you are changing the shift towards active agents of change, and individuals, whether they're citizens, refugees, migrants, what have you, are right holders, right? And the state as the duty bearer. And so this relationship, the way that it links the relationship and all of the issues that were discussed beforehand in terms of trust, what have you, they create this relationship by which citizens or individuals that are living in a country are paying and contributing with their taxes and with their work within society, and then government should have enough revenues to be able to redistribute. And I think this idea of a social contract needs to be accompanied. And I'm currently working on some research as well on fiscal policies and links to social protection. And there's this importance of mentioning also this fiscal pact, a long-term fiscal pact, by which you are, to a certain extent, sort of strengthening this reciprocal relationship between right holders and duty bearers, and in which, if you had a system that people could trust, then you would have more people willing to be actually paying taxes and tax collections increasing, right, in government. So a life cycle, the importance of a human rights-based approach and a life cycle approach is that if we think of a system, a social protection system, instead of looking at it of palliative, fragmented sum of different little programs, and we think of it from a life cycle perspective, you see that individuals across the life cycle are right holders. That means that it's not, social protection isn't just for the poor, quote unquote, those that are disabled, elderly people, what have you. Social protection is meant to be there to cover people across the life cycle through different risks, shocks, and vulnerabilities that they might face across the life cycle. And so social protection should be conceived as that. And then we would have a more comprehensive social protection system, as was discussed before. And another aspect that I wanted to sort of highlight from a human rights-based approach as well is this distinction between having household benefits, such as, for example, poverty-targeted schemes are usually household benefits, versus individual life cycle benefits. Why is this important? Again, as I said, right holders across the life cycle are right holders, right? Individuals. That means that if we are only providing household programs, we might be leaving lots of people within that household behind. We're forgetting about power dynamics within households, could be gender, what have you. But in many instances, you've got households that also are intergenerational households that are composed of also a person with a disability, of an older person, children under 5, for example. And if you only provide poverty target household benefits, you might be leaving lots within the household behind. And that, again, from a life cycle perspective, I think is an important view. I don't have time to go into all of these aspects, but one of the key aspects or one of the key values or added values of thinking about social protection from a human rights-based approach is that we can take and we can sort of use some of the human rights principles, obligations, standards, criteria that are stemming from the international normative framework applied to social protection and use that from the high-level design of any social protection program to the very, very basic implementation of social services at what we call sort of the street bureaucracy or street level implementation, right? And we don't have time to go into these, but these are extremely important, right? If we forget any of these, if we don't, many times when we think about social protection programs and the design of social protection policies, we might have the best of intentions, but if we don't incorporate human rights principles, in particular those around, for example, dignity and autonomy of individuals, we might be infringing upon individual dignity, or we might even be hampering access to the right to social security, the right to social protection in the first place, right? So this is also very important. And unfortunately, in my social protection career, what I've seen in many times in terms of policymakers is there's the best of intentions, but when it comes to actual implementation of the programs, or when it comes to designing those social protection programs, there's no considerations whatsoever of these human rights principles and obligations. And again, I always like to think of social security and dignity being at the very core of any social, economic, or cultural right. But in the case of social security, they're particularly important, right? So when we think about, to bring it into sort of more practical terms, what is a charity-based approach? Many times it links to this issue, or this idea, or this discourse that we see in many countries around deservingness, right? When we focus social protection discussions, when we focus social protection design into the deservingness, which is what happens many times with poverty targeted schemes, right? We're looking into those who are actually the deserving poor, or those that are deserving social rights. We triggered some of these discussions, and we end up delivering and designing and implementing schemes that are aimed at the other, at the poor, right? Versus the life cycle approach. And this othering is as well, and sort of linking social protection programs or schemes or services to some specific groups, can also lead to stigmatization, right? And again, as right holders, we all have the right to social security, to right to social protection, if we face any of those life cycle risks and shocks that we discussed previously. So that's also an important aspect that we need to remind ourselves. This is something just, when we think of dignity at the core of social protection, we need to start sort of analyzing with a critical eye some of those ad hoc programs or fragmented programs that have been put in place, right, in general. And sort of, for example, poverty targeted schemes, in many instances, even though global evidence has shown some of the pitfalls around poverty targeting, for example, and sometimes there's within what I call sort of the technocratic cadre of international social protection experts, what I call a willful blindness in not looking at the human rights and political and social implications of some of these social protection tools. Like, for example, that the proxy means that are being used. Proxy means, unfortunately, in low and middle income countries, in many instances, don't have enough information, and they don't have the correct information to be able to target people effectively. And that's why they end up with such huge exclusion errors within those that are intended beneficiaries. And so we have to think of these things when we look at social protection from a human rights-based approach, because otherwise we're sort of facilitating the further exclusion of people that should be linked to social protection and should be able to access this right. And then there's one other thing that I always discuss, which is, and I don't know whether this is the case. I haven't been working in Lebanon long enough to know whether this is something that happens in Lebanon, but I assume it is, because I've seen it pretty much in every single country that I've worked or lived in throughout the globe. And this is the overarching narratives, negative narratives around poverty, right? Those that are experiencing poverty are lazy, they're sucking up the resources from government, they should be working, they're using the little money that the government is giving and using alcohol and tobacco, what have you, like these temptation goods and what have you. So unfortunately, there is a lot of these poverty narratives that have an impact on social media, on policymaking, and on storytelling. And ultimately, policymaking, even within the social protection sector, is about storytelling. And if we have this view, such as, for example, this view of meritocracy or self-made arguments of I made it because I was actually hardworking and what have you. And this is particularly important in contexts in which inequality is high. I was quite surprised to see, I currently live in Latin America, which is the most unequal region. And I've seen that in the latest studies, it is the MENA region that has actually surpassed Latin America as one of the most unequal regions in the world. So in particular, in very unequal settings, thinking about the self-made and the issue around meritocracy is absolutely important, because the way that we tell stories, the way that we sell policies, the way that we tell stories around policies actually impact the design and implementation of these programs, right? And so if we only focus our discussion on social protection on those issues around deservingness, issues around poverty narratives, those who make it can actually make it, that pull up your bootstraps, and we don't have any human rights considerations, and we focus it on fiscal austerity and making sure that these policies are efficient, then we can end up with social protection programs and policies and systems ultimately that are not inclusive and are not based on human rights. And the relationship between the previous speakers also briefly mentioned the relationship between fiscal policies and the redistribution powers, right? And so linkages between social protection policies and fiscal policies, and sort of finding the fiscal space to be able to increase investment in social protection is also of utmost importance. From a human rights-based approach, again, government states are meant to do as much as possible, right, to be able to find the fiscal space, to be able to sort of increase investment so that more people sort of are covered within those social protection programs, right? And ultimately, fiscal space and fiscal prioritization also very much is a reflection of prioritization within a government in terms of what is important, right? And as I said before, given that it's such an unequal region, the MENA region as well, it is important to think about it. One little principal obligation that I wanted to sort of highlight on this relationship between fiscal policies and social protection is this idea of use of maximum available resources and non-retrogression. This is a human rights principle that applies to pretty much all social, political, social and economic and cultural rights. But in the case of social protection, I think COVID-19 has made it absolutely evident of the need to focus our eye on making sure that there is more fiscal space. There is an obligation of by states to actually be able to provide more fiscal space, and all of their available resources, whether it's at the national level or it's through international cooperation, to be able to increase expansion and then expand coverage of social protection, right? And one thing that if countries are not doing enough within their means, within their powers to do so, that can be seen as hampering the right to social security in particular. One aspect that is absolutely crucial within, I mean, even with the Washington consensus, but from moving forwards, but in particular, given the COVID-19 situation, which is these measures or these pushes for fiscal austerity, right? From a human rights-based approach, fiscal austerity is not an excuse to be able to sort of highlight or to sort of reduce the cost, reduce spending going into social protection. So one of the things that countries and also international financing organizations should be doing is making sure that when they put those fiscal packages together, this is not hampering social protection, access to social security. Unfortunately, in many of those fiscal austerity pacts that countries have been signing, or those agreements or negotiations with organizations such as, for example, the IMF, in many of those instances, there's particular mention of making sure that social protection is poverty targeted, right? Instead of focusing on life cycle inclusive social protection systems. So again, a sort of a word of caution in making sure that when those packages go through, there are actually human rights considerations. And as was mentioned before, the beauty, if you want, of some of those tax systems, and there are more, we don't have time to delve into detail into this, but the more progressive social fiscal policy and tax systems are actually able to have this sort of double sort of sword aspect or objectives of both raising sufficient resources so that we can increase coverage of social protection and investment in more inclusive social protection systems that are, of course, more expensive than poverty-targeted programs, and also in terms of reducing inequality and the redistribution of power. And then the solidarity pillar from the social security perspective comes in place as well here, right? So this is, I think, an important relationship and something to remind ourselves, because in many instances, what happens is that we forget that also tax policy and tax policies also have sort of this redistributive power. And it's not just social policies that are meant to do their work and that are the silver bullet to solving all of the problems in a certain country. So in terms of looking at how much countries spend in social protection, and again, this is coming from a wealth of different studies. And sorry that this has an effect, so I have to sort of click on 1,000 times to get all the little tables here. The idea is that if we think about how much countries actually spend on social protection as percentage of GDP, excluding health in particular, it's for OECD countries, it's around 15.7%. And many of these countries that we see here in blue actually have inclusive social protection schemes that are addressing sort of those risks and shocks across the life cycle. We see here that in the case of Lebanon, it's 6.23%, and that's mostly obviously on the social insurance side of things, which, as was mentioned before, doesn't necessarily cover everybody because we've got a large population within Lebanon. So just the same case as many other low and middle income countries that have a large percentage of their labor force working in the informal market, hence not covered by contributory schemes, right? And so what is important to remember is that even those countries that now have 15.7%, when they started at the level of some of these low and middle income countries at the same level of development, right, they were actually able to start investing in more inclusive social protection schemes. Let me see.
I'm sorry, Alexandra, to interrupt you, but you still have 1 minute to wrap up, please.
Okay. Okay, so then let me just we've already discussed, my predecessors have discussed the fragmented nature of social protection in Lebanon, so I'm not going to go into that. But again, in order for Lebanon to shift the paradigm and to move from a poor relief model of social protection to a social security model, an entitlement model, what needs to happen is that missing middle that is falling through the cracks from those poverty targeted schemes or ad hoc programs that were mentioned that are being left behind, and also those that are already covered by the contributory system. What needs to happen is that we create a multi-tiered system that provides an inclusive multi-tiered system. And this comes from an ILO and UNICEF study that was released last year in terms of making sure that Lebanon can sort of provide social inclusion, social security through all of those different tiers. And that's something that needs to happen. So again, social protection can also help within the crisis. That crisis was mentioned many times. The way that we see economic growth sort of moving towards with or without social security has an important impact. That it also has that impact, so it's important to mention. And then finally, so the last remarks are the idea that let's hopefully apply, just like in any other case, the golden rule, what I call sort of the golden rule in social protection. Let's create a social protection system that we would all want to benefit, that is based on those human rights considerations that I mentioned beforehand. And in order to create this inclusive and multi-tiered social protection system, hopefully Lebanon would start by creating sort of that first tier in investing in inclusive life cycle schemes such as disability grants, child grants, social pensions, as well as disability benefits, right? So it's important that Lebanon starts thinking towards that, hopefully sort of create that. And then that there is also that the link between fiscal policies and hopefully fiscal policies being at the service of social security and not vice versa. And I'll leave it at that. Thank you.
Thank you very much, Alexandra, for this very interesting and exhaustive presentation, including all the data which you have showed us. We still have, honestly, 5 exact minutes, so I'm not sure how many questions we are able to take. I would just like to tell Mr. Abdelsamad that we had a question about the data that you have kindly presented. If you can please, in the chat box, write down if you have any reference for this data, because one of the attendees asked if such data are available online and they can have access to. I ask now the public, I'm really sorry for this, but we are able just to take one question. Do you perhaps have? Okay, we have a question. I will read it, but I'm not sure we are going to have the time because we need to end the session at 11:30. But maybe the speakers, if they are kind enough to provide us with a response after the session is closed, and we'll send it to the attendee. So we have, from the fiscal perspective and fiscal austerity, and while Lebanon is negotiating with the IMF, how much of the universal social protection schemes can and will be compromised, and how? Has there been any discussion around this? The ILO put forth the social protection floor last year. Is it still relevant with the worsening of the situation? Is the government referring to it in its negotiations? Apologies for this. I don't think we are able to respond live to this question, but in the case, we can send it to the speakers and try as much as possible to provide you with a response. I would like just to close with some of the remarks. First of all, I would like to thank the speakers for being with us today. It was very interesting indeed, and I would like to remind all of the participants with us that this is part of a webinar series, as I have mentioned. So stay tuned for the upcoming sessions, which will unpack in details the pillars of the inexistent, if you allow me to say, the social protection and social justice system in Lebanon. So we will be talking about in details, for instance, about the informal sector and who are the informal workers in Lebanon, and explore as well the exclusionary mechanisms. So stay tuned. I would like also to remind you that the center is publishing whether briefing topics or briefing papers, and as well as infographics on social justice in general. Recently, if you are interested in looking closely at what the Lebanese state has been producing in terms of social policies, you can access our infographic, which you can see it online. We have mapped the policy decisions which the Lebanese state have been producing for the past over 2 years time. So if you are interested, please go on our website and you can find all the publications around this topic. Thank you again for your participation, and stay tuned for the upcoming sessions. Thank you for the speakers. Have a good day.